Greetings, everyone, and welcome to today's session of your musculoskeletal system course. I'm Dr. Sally, and today we're going to be covering the joints of the lower limb. So before we get started, I just want to go over the general concepts of studying joints and just basically what you need to know about joints whenever you're going through them, whether it's the joints of the upper limb or the lower limb or so forth. So, when it comes to joints, one of the things that you need to be familiar with are the bones and articular surfaces that make up the joint. So whenever we say, for example, the knee joint, the hip joint, whatever, okay, you need to be able to tell us what bones and what articular surfaces make up that joint. You also need to be familiar with the type of joint. Okay, you know that there are lots of different types of joints. You've got ball and socket, you've got hinge joints, you've got um, you know, plane type joints. So there's lots of different types. So you need to be able to say what type of joint you're dealing with. Another concept that you need to be familiar with is the motion that happens at a joint. Which direction and in what planes does that joint move? Can it move in two planes, one plane? And you know, what position will the limb be in when that joint is in motion? You also need to be familiar with the common patterns of injury that happen in certain joints. And of course, in order to understand that, you also need to know the stabilizing factors because you know that joints are points of attachment between different bones. So obviously, there are going to be things that are holding them together. So you need to be able to understand how all of that works, and then what will happen to those stabilizing factors to cause a certain injury. Okay, so what I've sorry, um, there are also certain terms to keep in mind when you're studying joints. These are going to come up a lot. Okay, so you're often going to hear about the capsule of a joint. Okay, and again, this just applies to any joint. A capsule or the capsule is generally the tissue that surrounds the bones that make up the joint. Okay, so if you've got two bones together, they have a layer of tissue surrounding the parts that make up the joint. And usually the capsule has an outer fibrous layer to be tough and to protect the joint. And on the inside, it's usually lined by a synovial membrane, which is usually smooth. And so that will obviously facilitate movement. You're also going to hear the term articular cartilage, and this is just cartilage that is found between the articular surfaces of the joint. And what it does is it acts as a cushion to kind of make sure that the bone ends are sitting comfortably with each other. And it also obviously reduces friction between the two surfaces. And you're also going to hear the term ligaments, and ligaments are rope-like structures that are attached between the bones. So they just basically serve to hold the bones together. And then obviously those are also going to be one of the stabilizing factors in terms of how the joint works. Okay, so what I've done with the joints of the lower limb is I've divided each joint into its own video. Okay, so we're going to start off with the hip joint. Alright, so the hip joint is the joint that is found between the femur and the hip bone. Alright, specifically, it is the articulation of the head of the femur with the acetabulum, which was the cavity that was found on the lateral side of the hip bone. Okay, so clearly you can see here, this is the hip bone, all right, and it's articulated with the sacrum and the other hip bone to form the pelvis, all right, and here you're looking at the upper end of the femur. You've got the trochanterus here, you've got the neck, and then you've got the head of the femur, clearly articulating or fitting into the acetabulum of the hip bone. So the hip joint is formed by articulation between the acetabulum of the hip bone and the head of the femur, as I mentioned. And in terms of type, it is a ball and socket type joint. So we saw in the picture how the head of the femur just kind of fit snugly into into the acetabulum. So think of the head of the femur as the ball, and the acetabulum as the socket, and they just fit together. Now, the functions or importance of the hip joint are the following. Number one, it connects the lower limb to the pelvis. So basically, it's a point of communication or connection between the appendicular skeleton and the axial skeleton. Okay, so that's just basically how the lower limb is attached to the rest of the body. The other importance of the hip joint is that it acts as a weight-bearing point of the body, okay, because obviously we stand on our legs or our lower limbs, okay, so most of our body weight is going to be distributed to that lower part, okay. So let's check out the movements that happen in the hip joint. So we've established that it's a ball and socket type joint that is formed between the head of the femur and the acetabulum, okay. So let's look at our skeleton friend here. Okay, he's basically striking a pose, and the arrows are indicating all the points of movement, that can happen at the hip joint. All right, so like I said with movement earlier, you generally need to look at the entire limb and look at what direction it's moving. Okay, and then you can kind of say what movements is happening at what joint. All right, so when you have a straight limb that is being moved forward, so kind of like you're kicking a ball, okay, that is flexion of the hip joint. Okay, but when it's moving in the opposite direction, so backwards, all right, when it's moving in the opposite direction backwards, so say when you're getting ready to kick the ball, okay, so you know how with football players they kind of just move their leg back to gain power and then they just rush it forward. So the backward movement of the leg or the lower limb, this is extension of the hip joint. So forward is flexion, backwards is extension, okay? The other range of movement is abduction and adduction, and you know that abduction and adduction are related to the midline of the body. Okay, so if you're kind of moving your leg to the side or your lower limb to the side, okay, so away from the midline, that's abduction. But if you're crossing, if you're crossing your lower limb, okay, so to the opposite side, or you're crossing it over the other leg, then that is adduction, because clearly you're bringing it closer to the midline, okay? The third range of motion is what we call external and internal rotation. And the best way to kind of imagine what direction of movement this is to think about your toes. Okay? If you're moving your toes and your foot, sorry, not your foot, just your toes. If you're rotating your toes to the outside, okay, that's external rotation. Okay, in the arrow here you can see that's kind of moving to the side. And if then you start rotating your big toe to the inside, okay, then that is internal rotation. All right, so the movements that happen at the hip joint, we saw flexion and extension, we saw abduction and adduction, we saw medial and lateral rotation. That's the same as internal and external rotation. Okay, and you need to be familiar or figure out which muscles are acting on the hip. And like I said in a previous video, as long as a muscle crosses the joint, then that means that it's going to act on it. All right, so you've got certain muscles of the anterior compartments of the thigh that cross the joint, and I'm not going to tell you which ones those are, because if you already saw the previous video, you should know them. You've got the gluteal muscles. Again, they cross the hip joint between the gluteal region and the upper end of the femur. You've got the adductor compartment of the thigh. The muscles muscles of the adductor compartment, remember, they all take origin from the pubic bone at some point, and then they move downwards, so they're crossing the hip joint. And the muscles of the posterior compartment, which are the hamstrings. All right, so we mentioned that there are going to be certain stabilizing factors which serve to kind of hold the bones that make up the joint, they hold them together, okay, and they serve to protect the joint as well. So let's look at the capsule of the hip joint, okay. So what we're looking at here is a picture of the bones that make up the hip joint, but they've been separated. So the head of the femur has been pulled out of the acetabulum here, and you've got the hip bone, and you've got the femur over here. All right. So I want you to focus on the line in red and the line in white. Okay. Now, this is the margin of the acetabulum, or the acetabular labrum, all right? And this is usually just the region where you've got the intertrochanteric line and intertrochanteric crest at the back here, okay? So these 2 points, this red line here and this white line, represent where the capsule is attached. So basically it's going to be attached to the margin of the acetabulum, and it's also going to be attached to the upper end of the femur. So clearly, if it's attached to these 2 points, then that means that it covers the bony parts that make up the hip joint. And when we put the femur back in here, then it's going to end up containing the 2 and protecting them from the outside. Okay, so the capsule of the hip joint has 2 points of attachment. It is attached to the margin of the acetabulum proximally. So remember, when we talk about proximal and distal, we talk about closeness to the axial skeleton and closeness to the body. Okay, so its proximal attachment is the margin of the acetabulum. Its distal attachment is going to be with the femur, and it has an anterior distal attachment and a posterior distal attachment. So anteriorly, on the distal end, it's attached to the intertrochanteric line. Okay, so let's just go back there. Okay, so the intertrochanteric line is going to be this part here. Okay, so that's its anterior attachment. And then posteriorly, okay, don't make the mistake of saying the intertrochanteric crest, is going to be attached to the neck of the femur. So just the lower margin of the neck of the femur, okay, that's where it's going to be attached distally on the posterior side. All right, with ligaments, there's a couple of things you need to remember. Okay, number one, the ligaments are usually named according to the bones that they're attached to. Okay, so if it's going to be attached, for example, between the ilium and the femur, we're going to call it the iliofemoral, and so forth. Okay. The other thing to keep in mind with the ligaments is that they are classified according to their location. Okay. They can either be found inside the capsule or outside the capsule. Okay, and then in that case, we're going to either call them intracapsular if they're inside, or extracapsular if they're outside. Okay, so what we're looking at here are 2 pictures. One is of the anterior view of the hip joint, the other one is the posterior view. Okay, and like I said, the ligaments are named according to their attachment. So you've got one ligament, for example, that extends between the ilium and splits to attach to the trochanters of the femur. We're going to call that the iliofemoral joint. That's going to be found anteriorly. You also have a ligament that extends between the pubic bone and the femur. So we're going to call that the pubofemoral joint. Posteriorly, the ligament attaches to the ischium and the femur. So we're going to call that the ischiofemoral ligament. So like I said, you have some ligaments that can be extracapsular or intracapsular depending on their location. If you remember in the previous picture, there was a ligament that passed between the head of the femur and the acetabulum. That ligament was called the ligament of the head of the femur. Now, this is an intracapsular ligament because it's found inside the capsule. And like I said, it attaches between the acetabular fossa and the fovea of the femur. If you remember, the fovea was this little depression that was found at the head of the femur. So the ligament of this ligament attaches between that fovea and the floor of the acetabular fossa. We've got the iliofemoral ligament, which is classified as extracapsular because it's found outside the capsule. It's Y-shaped, like I showed you in the picture. It splits into 2 limbs. It attaches between the anterior and inferior iliac spine and the intertrochanteric line of the femur. You've got the pubofemoral ligament, which is again extracapsular. It passes from the superior pubic ramus and also attaches to the intertrochanteric line. So basically with the intertrochanteric line, you've got two ligaments being attached there. You've got both limbs of the iliofemoral ligament where it splits, and then in the middle of those two, you've got the pubofemoral ligament. And then finally, you've got the ischiofemoral ligament, which is again extracapsular, and this attaches between the body of the ischium and the greater trochanter on the posterior aspect of the femur. Okay, so we're going to stop for a second at a thinking point. And I want you guys to just think for a minute about how the hip joint and the shoulder joint differ. Because if you think about it, the general arrangement is the same. You've got a joint that attaches the limb to the axial skeleton, okay, and it suspends the limb from that part of the skeleton. So the shoulder suspends the upper limb, the hip joint suspends the lower limb. So how are the two different from each other? I'm going to give you a minute to think about that, and I hope you can hear this music. I don't know how it's going to work out, but let's give it a go. Okay, so just to make sure that this video doesn't drag on for too long, okay, the differences between the hip joint and the shoulder joint is that number one, the hip joint is more stable. This is because the articulating surfaces of the hip joint fit well with each other. So you saw how the head of the femur was fitting properly into the into the acetabulum. Okay, with the shoulder joint, the head of the femur is relatively large when it compares to the glenoid cavity, so they're not going to fit properly with each other. And since the hip joint is more stable, then this means that it is less likely to dislocate, and we know that the shoulder joint is one of the commonest joints that dislocates in the body. The other difference is that because of its stability, the hip joint has less range of motion. Remember, the shoulder joint could move around in a lot of directions. With the hip joint, the range of motion is a lot less. And they are both designed to have different functions. Where the shoulder joint is designed to have a wide range of motion, here the hip joint is functionally designed to bear the body, the weight of the body. Okay, so that brings us to the mechanism of injury of the hip joint. And like I said, because the hip joint is strong and stable, dislocation of this joint is not common, so it doesn't happen a lot. And usually, if it does happen, it has to or it happens as a result of a very big trauma, like a car collision. It usually occurs as a complication of a very big trauma. Okay, so if it does happen, so if the hip is dislocated for whatever reason, usually the dislocation is likely to be posterior. Okay, this means that the head of the femur tears through the capsule of the hip joint posteriorly. So basically, the head of the femur moves backwards. It's going to tear through the capsule, and then instead of being located within the acetabulum, it's going to be found in the posterior aspect of the body, so closer to the gluteal region. And this is usually common, like I said, with car collisions, because the person would be sitting like they're sitting in a chair, And then usually the collision happens head on, so the front of the car crashes into something, and then the dashboard is going to end up hitting um, the victim on the knee, and then pushing the femur backwards, which then causes the posterior dislocation. So on an x-ray, this is what a posterior dislocation of the hip joint would look like, okay? On this side here, you can see the acetabulum and the femur are obviously, you know, normal, okay? But here you can see how the head of the femur has been displaced from the acetabulum and it's pushed towards the back. Okay, so this is what a posterior hip dislocation looks like on an x-ray. All right, so that is all I have for you regarding the hip joint. I hope that session was useful. And just a quick boost of positivity for you guys. Remember or try to keep in mind that impossible is just a concept that people create in their minds. And if they say it's impossible, it only means that it's impossible for them and not for you. So if you believe anything, you are very likely to achieve it as long as you work hard. All right, so let's wrap up this video and move on to the other joints of the lower limbs. So I will see you guys next time.